Good morning, Peter Goertz. I'm a psychiatrist. Saying no to patients. We want to be respectful and caring, but in my opinion, saying no to patients and people, period, is important. Could be patients, could be your wife, husband, child, colleagues. And that, in my opinion, is part of being respectful and caring, is being able to say no. And by doing that, you can help other people, actually. They may not notice it in the moment, may not like it, but I think it definitely can be helpful. When a patient comes to your office asking for a Xanax or Adderall, do you just want to prescribe that? Very likely not. One aspect is currently hospitals and clinics give patients surveys to fill out, so evaluations of their doctors, and patient satisfaction is focused on quite a bit by hospitals and clinics. However, a doctor may be giving very good care and the patient satisfaction may be very poor at certain moments in time. For instance, if the doctor does not want to prescribe Adderall for a patient or sets another boundary. And the same would be if you gave your wife a survey right after you say, no, I don't want to go to such and such a restaurant for dinner tonight. She may not give you a good rating either. So there are different aspects. And this issue came up for me today, because over the past week, patients have been asking me for things that I thought were not necessarily wise things to do. A patient asked me to prescribe a medication for him or to continue prescribing it, but I hadn't seen the patient at that point for 2 years. And I really didn't feel great about it, but I did prescribe a 30-day supply because his primary care doctor did not prescribe it and he did not have an appointment to see me. So he needs to either have his primary care doctor prescribe that medication or get in soon to see me, which can be tricky, of course. And some medications, that particular medication, it's not wise to stop abruptly. So there are pros and cons for stopping a medication, even if you haven't seen a patient for a long time. You don't want to do anything dangerous. So in that case, I just continued prescribing the medication. Another patient whom I'd not seen for maybe almost 2 years asked me to write a letter for an emotional support dog. And I let her know that I'll need to see her before considering writing that letter. Patients may ask you to write letters so they can be allowed to carry a concealed gun. Patients will ask you to write letters so they don't have to perform jury duty. That actually, I've been asked many times for letters like that, and that actually is something I've always done so far. But conceivably, you may think, oh, it's really clinically important for the patient, and they're actually someone who might be interested in doing that. You may want to discuss, this could really be an advantage for you and could help your self-esteem, for instance, and might be interesting for you. A patient may ask you for hugs, and I've done that in the past on occasion. You want to go with what feels right to you in the moment, and if you get the feeling that there's physical attraction, either from your perspective or from the patient's perspective, you don't want to do that. And to push it a little further, patients may ask you out, and of course, that's not a good idea. People may ask you for early refills of Adderall. If it's just a few days and you don't have the feeling the patient potentially could abuse Adderall, then you may be comfortable giving an early refill. But if it happens regularly, that probably is a warning sign that the patient might be, at times at least, taking more than prescribed of the Adderall. Sorry, there's a lot of thunder here now. And simple things can happen, simple questions can be asked. A patient may wants you to increase the dose of their antidepressant and be quite focused on that, really want that, they're feeling depressed. But if they're concurrently on another medicine, that can be tricky. For instance, the antidepressant might increase the dose of the other medicine. So, if you increase the dose of the antidepressant, that might increase the level of the other medicine in the blood, which might potentially be dangerous. So there can be different aspects. So even with a simple request like, can you please increase the dose of my antidepressant, you may need to set boundaries and not do that at that point and look for other options. Patients may ask you what your age is, what your marital status is, and that can come sometimes out of the blue, may blindside you, and you can feel free to answer if you want, and I've done that many times, but you can also feel free to say, I don't feel we need to focus on that, let's focus on you. So you can also feel free to not answer it, but be courteous and warm and focus on the patient instead. People may ask you for telephone visits instead of in-person or virtual visits, and that probably is not a good idea, at least in my opinion. I don't like just telephone visits. They don't give me the clinical information that an in-person visit or a virtual visit, video visit would give me. So I don't do telephone visits with patients. Even virtual visits can be tricky. I prefer in-person visits in general. I do plenty of virtual visits, but on average, I prefer in-person visits because I can examine the patient, for instance, listen to their heart, check for extrapyramidal symptoms, if they're on an antipsychotic, for instance. And some patients, though, if they live far away, they may really prefer virtual visits, which is understandable, of course. But I ask even those people, even if they're elderly, have trouble walking, I still ask them to come in to see me in person at least once a year. And I think that's clinically important. Now, another side of the issue is if you don't say no when you want to say no, that can lead to resentment on your part. And then that can interfere with the treatment. If you're harboring resentment toward a patient, that does not help your treatment with the patient. So bottom line, in my opinion, feel free to make no one of your favorite words. And if you're not comfortable with confrontation, you probably want to try your best to get at least somewhat comfortable with confrontation. I'm not talking about physical confrontation or shouting, but just confrontation in the sense that the patient really does not like what you're saying, but you want to stick to what you're saying. Thank you.